Hello and welcome to another episode of Podcast DX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm ready to get out of here and enjoy the beautiful weather.
She's Jean Marie.
Okay, sorry.
Collectively, we're the hosts of Podcast DX. On today's show, we're talking about general, like not general.
Not rank.
Yeah.
Mm-hmm.
Medication safety.
What an intro. According to the Centers for Disease Control and Prevention, otherwise known as the CDC, and data from the National Health and Nutrition Examination Survey, 45.8% of the U.S. population used prescription drugs in the past 30 days. Prescription drug use increased with age from 18% of children under age 12 to 85% of adults age 60 and over.
Wow. 85%.
Mm-hmm. Think about that one for a minute.
Yeah. Mm-hmm. Medications may include prescription medication, over-the-counter or non-prescription medication, and herbal medicines. Of course, herbal medicines is where all our medications really come from, right?
No.
No? Okay.
No, they're synthetic medication.
Okay. They may come in many different preparations or forms and may be administered through various routes into your system. These may include those that are ingested or eaten. Those forms are tablets, capsules, powders, sprinkles, chewables, granules, or liquids. Those that you inhale, those are inhalers, like for asthma or whatever, aerosol, nebulizer. Those that you put in your eyes, ears, or nose. They could be drops, gels, or films. Those that you insert, suppositories, injectable medications, transdermal patches, nicotine or fentanyl are two of the ones that come to mind.
Yep. Mm-hmm.
Yep. Implantable devices and pumps can also administer medications, and some medications that are administered by implantable devices are contraceptives, insulin, and pain medications. There are also topical preparations that you rub on, lotions, creams, and ointments, and those that you need to dissolve under your tongue or in your mouth, sprays, tablets, or films. Some medications come in multiple preparations. So if, for example, swallowing medications is a challenge for you, you may want to consult your healthcare provider and pharmacist to see if there are other routes of administration or forms of the medication that would make it easier for you to take.
Sure. And typically medications are sold by the company which conducts the clinical studies and initial research for a drug. And then they sell that medication once the FDA approves it under a name brand or as a name brand product. And then several companies may also sell the active ingredient later on once licensing is, no longer applied, as a generic version of that same medication. There are a few instances where the name brand medicine is the only and the best option for you. However, the medicine's active ingredient would be the same in the name brand and the generic. But the rate at which the medication dissolves or what filler components that they use may vary. And other factors may be different between the name brand and the generic formulation. So you always want to consult your healthcare provider. And your insurance company may require that you try a generic form of a medication before they will pay for a name brand version. So if the generic doesn't work for you, they may make you try that and then switch over to the name brand version. Or you and your healthcare provider may need to write an appeal specifying why you need to take the name brand medication before your policy will cover the name brand because it's more expensive. Many prescription drug companies have programs to assist individuals who are having difficulty paying for the name brand. So it's definitely worth checking, their website and checking with your healthcare provider to see if there's a patient assistance program available.
And medications are often prepared in a range of doses. A dose is typically quantified as a weight, either milligrams or micrograms, or as a volume, such as milliliters or drops. The number of capsules, tablets, or packets taken, or other means for describing the amount of medication taken at one time. The dosage refers to the frequency at which a drug is taken. For example, take 2 tablets every 4 hours. Some people set up daily or weekly pill boxes to help them take medications as directed, so they won't forget. There's also apps, timer caps, and dosing machines to help you take your prescriptions as prescribed by the physician.
That's right. And if you take more medication than the dosage indicates, then you have taken an overdose. There are often accidental or intentional overdoses. Taking too much medication is dangerous and may even be deadly. Never take medication that was prescribed to someone else. To avoid taking the wrong dosage, make sure that your healthcare provider knows your current physical weight, which is used to calculate the dosage, a list of your known food and drug allergies, a list of any medications that you have taken in the past to which you have had an adverse reaction, and a complete list of all medications that you are taking currently, so that they can avoid giving you additional medicines with the same active ingredient.
Yeah, I know when my primary care civilian physician prescribed cough medicine. I guess it had codeine in it.
Oh.
And so a flag was sent to my primary care physician at the VA to notify them that I'm taking an additional dosage of codeine.
Okay. So it's good that the computers are connecting the dots.
Yes, because I did not call and tell him, which I should have.
At the pharmacy, confirm that the dosage information on the prescription matches the information provided by your healthcare provider, and make sure that you thoroughly understand the dose measurement. For example, when you're measuring a liquid medication, make sure that you know which scale that you're supposed to go to. Is it the ml scale, at the cc? Is it a capital T, like a tablespoon, or a small t, like a teaspoon? To use, you have to know which scale to use and what a dose will look like in the measuring device that you'll be using.
Yeah, have you ever seen like they'll have like a little tiny cup and there's multiple lines on that cup?
Right. How do you know which line to
Right.
go to? At home, store the medication correctly and keep track of when you take your medication. Or if, for example, one or more individuals administer medication to someone in their care, keep a clear, accurate record of when each dose is given and by whom. Those taking multiple medications need to be extra cautious to ensure that they take the correct ones, medication, dose, and dosage. Those taking medication for diabetes, they also keep track of their blood sugar levels to avoid overdosing.
And since we are talking about medication safety, we should definitely talk about opioids, which have been spotlighted in the media recently. Opioids are also known as narcotics, and they include strong prescription pain relievers such as oxycodone, hydrocodone, fentanyl, tramadol. And a healthcare provider may give you a prescription opioid to help reduce pain, maybe like if you've had a major surgery or you had a really bad injury or you are in severe pain for some other reason, maybe like during cancer treatments. And opioids are known to be addictive and whenever possible should only be taken for a very short period of time. According to the Centers for Disease Control, opioids are involved in nearly 50,000 deaths, and that was a statistic, thank you, from 2019. And if you or a loved one is taking opioids, you may want to request from your healthcare provider and pharmacy a Narcan kit. And Narcan is a potentially life-saving medication designed to help reverse the effects of an opioid overdose. And since most opioid overdoses occur at home and they're often witnessed, having a Narcan rescue kit nearby can make all the difference. If you or someone you know takes prescription opioids, ask your healthcare provider what signs and symptoms of overdose to look out for and what actions you should take in case of an overdose.
That's great advice, Jean. Thank you.
Mm-hmm.
Now let's talk about timing
Like
of
on a,
taking your medication.
oh, okay. I was going to ask about a car, but no. Okay. Timing belts. Sorry.
Again, a different episode.
Okay.
The instructions on the pill bottle simply may say take once a day, yet the specific time of day you take your medications may make an important difference. Inside each of us ticks a finely tuned master clock driven by a tiny region in the brain that keeps us all in sync with the Earth's cycle of light and dark. This master clock also directs a host of peripheral clocks found in the organs, tissues, and cells. The body doesn't respond to medications in the same way at different times of the day. Some drugs are not as effective or are as well tolerated if they are taken at the wrong biological time. It's not that they're not effective at all, but they're certainly much less effective. In fact, drugs labeled take one a day often work better when taken at night. Modifying the timing of drugs to achieve the greatest benefit with the lowest risk of unpleasant side effects is called drug chronotherapy.
Thank you, Ron, and the AARP website. Okay. And make sure that you understand that you should take your when you should take it, and then also maybe ask your physician what you should do if you happen to miss a dose. And to go along with what Ron just said about timing, you also need to be aware that some medications need to be taken with food. Some need to be taken when your stomach is empty. Some medications can't be taken with some foods because of interactions, and some medications are just right.
I've heard that bedtime story before.
Mm-hmm. And some medications should not be given to bears. So it's essential to know that food and beverages can affect the medication's effectiveness, and make sure you are aware of that and get that information.
That's right, Jean. Regarding food-drug interactions, we should also note that some foods and drugs, when taken simultaneously, can alter the body's ability to utilize a particular food or drug or cause serious side effects. Some medications need to be taken with food to help prevent oysters.
Oysters?
Oysters.
What? I had the worst case of oysters the other day because I took my Tylenol with some bat wings.
Ulcers.
Oh.
To help avoid ulcers.
Okay.
The oysters are fine. Or help avoid stomach irritation. There is a lengthy list of food-drug interactions, so ask your healthcare provider or pharmacist if any or all of your medications have such restrictions. The list is long, so my advice is to ask the doctor whenever you have a new prescription. Mixing medications can also result in issues. Always bring a complete list of any and all medications with you when you're going to a doctor, dental, or vision appointment. And this can be especially helpful if you're being treated by more than one healthcare professional. You don't want anyone to accidentally, like Jean was saying, prescribe something that will react to what you're already taking. Another piece of advice:
Okay.
alcohol and medications do not mix.
And I do want to say, like, one that you hear a lot of times is grapefruit juice.
Yeah.
But then when Auntie Mary and I were in Italy, she wouldn't drink the blood orange juice because it looked like grapefruit juice.
Oh.
But yeah, so you always want to, ask
what it is.
Yeah, ask your pharmacist what you can and can't drink or take. If you have opioids, for example, in the house, you want to store them safely. So you may want to put them in a lockbox, and the top of the container, you might want to include a timer lock, which won't let you open it until a certain amount of time has passed, so that you're not taking too many. Medications should be kept in their original packaging with the prescription, manufacturer, expiration date, and lot information on it. And whenever possible, keep medicines in a cool, dark, dry place, safely up and out of sight. And hopefully Lita's emailing you with the rest of the script right now. And safely away from children and pets. Do not store medication in a vehicle which can expose, which, undergoes extremes with heat and cold. For example, if you have, or someone in your family needs to keep an EpiPen with them, never leave it in the car. You want to make sure that you take it with you. And if you forget about that, you'll maybe put a pouch connected to your car keys so that every time you get in or out of the car, you take it with you, because leaving it in the car can make it ineffective because it's exposed to extreme heat and cold. Avoid keeping medications in the bathroom because high humidity from bathing in showers can degrade the medication and make it ineffective. And if your medication needs to be refrigerated, keep it in the refrigerator or temporarily on an ice pack in a cooler. For example, there are specialty made mini coolers and mini ice packs for people that need to take their insulin bottles with them to keep it at the right temperature.
Yeah, I think you got one of those for Kathy, didn't you?
I've gotten I've gotten them for a couple people that we know with diabetes. I also got it for Gina's husband.
Oh, okay, Andy.
Yeah. Mm-hmm.
Well, as we've mentioned a few times now, you should always keep an up-to-date list of all the medications you're taking, including the dose and dosage information, and a list of any medications that you're allergic to, and take that with you to any medical visits. If you keep it on your cell phone, the list, then you got it with you, because most people have their cell phone with them all the time.
Okay.
I like to keep a copy in my wallet, on my phone, and I'll call or message my primary care provider with any updates so that my file is also kept up to date.
And as we've learned, I don't do that. I need to do that. As someone who takes several medications each day in various forms at multiple times, I like to be extra cautious before taking a medication for the first time, and whenever I receive like a new container of medicine, I always double check it against my list. And my list is like a little complicated. I don't know if I need to go into it, but I like to, I have a physical description of what my pills look like. And then if it's a new medication, I go online to like drugs.com to make sure that the pill or whatever the medication is matches that description. For example, I'll list like omeprazole delayed release, which I take for acid reflux, 120 milligram dose, which comes in the form of a yellow and white gel cap with the markings KU118 imprinted on it. And I need to take that before meals. And this is what works to help keep me organized. In the past, I've received the wrong medication, and I realized this when I opened up the bottle to double check it, and the physical description did not match the medication I was prescribed. Also, there were like multiple medications in that bottle, and it turns out my sleeping pill had been mixed up, and this was on a grand scale because this was a mail order pharmacy. They had accidentally dispensed erectile dysfunction medication instead of the sleeping pills. So a lot of people were up all night and didn't know why.
Well, what you mentioned earlier about a time sensitive, like safe, I think is a great idea.
Okay, yeah. Thanks.
You definitely want to keep them out of sight for one, because especially with younger children, they like to put things in their mouth, and when they get out of your sight for a second, they can go anywhere. And if it's in their plain sight, the next place it's going to go is in their mouth. So
Right.
if you have young children, and just in general, keep them out of sight.
Okay.
And one of the things also, and I think you mentioned it, like with the car and all that, try to keep them out of the light, out of sunlight,
Mm-hmm.
because that can adversely affect it or
Sure.
or make it not as
Effective. Yeah.
strong
Absolutely.
as it needs to be.
Right.
Right.
So I think a lot of times people say use common sense,
Mm-hmm.
but again, it's a lot of just making sure that you put them away.
Mm-hmm.
And also, when you take them, know exactly what you're taking, how much, and at what time.
Right,
I think
yeah.
that was interesting what we were talking about earlier about when it's taken one time a day, it's usually better to take it at night.
Mm-hmm.
But know exactly when you're taking and try to take it at the same exact time every day.
Right.
Right. And I think you should never pretend that medication is candy.
Oh, I got a story.
Oh boy.
I got a
Of
story.
course you do. And never use medication or like a bottle of medication as a rattle or a toy.
Right. When I was a kid, I was given X-Lax, a little piece of X-Lax, because
I'm afraid to hear the rest of this.
because I guess I was constipated.
Okay.
And I liked the taste, and my mother, I guess, had it somewhere not really safe, and I ended up eating the entire box of X-Lax, and I'll tell you,
It was effective?
I
That can be
think
very dangerous.
I think I'm still going today.
Oh, boy. It explains so much. We'll have a link for upandaway.org on our website, and that has more information about to help you keep your children safe and away from medication and prevent them from accidentally ingesting medication.
Right. Don't tell them it's candy.
No, yeah.
Yeah, because a lot of I've heard a lot of parents say, "Oh, it's like candy. Just take it." Well, then the kids think it's candy. They're going to take as much as they want. Not a good thing.
No.
All right. Older adults in the U.S. are far more likely to be taking, like we already said, 85% of older adults are taking medications, and they're far more likely to be taking several medications at the same time. For older adults, a pill box and a timer may be the easiest way to make the correct medication and dose work out for you. Make sure that your healthcare provider, make sure you ask your healthcare provider what the medication is supposed to do, how you will know if it's working, what side effects that you might have from them. You need to know these things.
Mm-hmm.
It may be challenging to manage multiple medications, and there are a number of systems, apps, and machines that can help older adults keep track of their medications. Be open and honest with your healthcare provider. If you hate taking medications, if medications make you feel worse, if you find it difficult to take the medications on time, let them know. I was recently surprised.
You were recently surprised by a prescription.
I was recently prescribed a medication to help lower my cholesterol. Unfortunately, one of the side effects was back pain. My back pain was so bad, I did not want to take the medication or even move. My healthcare provider told me to stop taking the medication and prescribe one that works differently and doesn't cause back pain.
Yeah, I know that like some people will go take the prescription from their physician, take it to the pharmacy, fill the prescription, and bring it home, but have no intention of ever actually taking the medication. And if that's you, talk with your physician because they may have other options for you.
Right.
And if you have pets in your home, just make sure that they cannot gain access to any medications, and it might behoove you to teach your pets, leave it, so that if you drop something on the floor, you can medication on the floor, they'll leave it.
Right.
And hey, Ron, do you ever clean out like your junk drawer?
Why, yes, I do.
So maybe.
And I have thrown out several prescription and over-the-counter medications because they have expired.
Oh, all right. And then
I think that was a leading question.
It was a leading question.
It was.
And in addition to disposing of them in garbage after mixing them with something unsavory and unpalatable, does your pharmacy, police department, or fire station accept expired or unused medications?
Well, actually, they do. You guys are aware recently my mom passed away, and
Yes.
she was on a lot of medications that we've spoken about earlier in this episode. And I contacted my local police station, and I brought them all of her expired medication so that they could dispose of them properly rather than throwing them out or pouring them down the drain.
Right.
I made sure I went to the police department so they could take care of it the correct way.
Right.
That's
And
great.
and there's several reasons why that's important. You don't want to have that medication in our water supply. And if you flush it down the drain, that's where it's going to go. If you flush it down the toilet, that's where it's going to go, because it does get processed, but the medication part might not get processed out. So or it might end up affecting the fish, and then you eat the fish, and then you still get it. So don't flush it down the toilet. Don't flush it down the drain.
Right. And actually, there's some companies that collect from pharmacies, police departments, fire stations, and et cetera, that incinerate old or unused medication, and by doing so, they end up creating energy. It's an exothermic reaction, so it's a way of producing power.
Oh, all right. I was just going to say, are they also making the birds that are?
No, no.
Okay,
No,
all right.
It's a closed system.
Okay, closed system. Got it. All right.
Why would you think birds would be near an incinerator?
No, I thought maybe they're flying overhead and they take a
Exhaust,
whiff
yeah.
of the
No,
exhaust.
yeah.
Okay, it's all safe.
Okay.
Let's talk about traveling with your medication.
Okay.
If
I
you-
always like to take my medication on a trip.
I have to take my medication on the trip. Oh, and then when you're traveling with medical cannabis, you might have to be careful on, are you crossing state lines that aren't
We're going to talk about that.
Okay. Anyway, when traveling, keep your medication in your carry-on bag. When possible, and definitely when traveling to another country, keep your medications in the original container with a clear prescription label from the dispensing pharmacy. So those pill boxes, not a good idea if you're traveling to another country. When possible, keep the medication bottles, pill box, and that type of thing in a clear, sealable bag as secondary storage, just in case a bottle or box accidentally opens en route. All medication labels must list you as the individual to whom the medication has been prescribed. It must be in your legal name, and that name should match the name listed on your identification and travel documents. It can also be helpful to keep a complete list of your medications, including dose and dosage, and the prescribing prescription and the contact information with you when you're traveling. If you end up losing your medication, contact the local embassy or consulate for assistance. They may be able to help you get a refill. In some countries, you can only bring with you a 30-day supply of medication. Also, certain medications may not be permitted legal in certain countries. It's always best to check in advance to see if you can legally bring all of your medications into another country. You don't want to end up in prison for drug trafficking for having a banned inhaler or a pain medication in your luggage. You may want to see a travel medicine specialist for vaccinations, preventative, and other treatment medications. It's always know before you go.
Yeah, I was kind of surprised that you can't take inhalers into certain countries, that they're verboten.
Right.
And Ron, would you say that prescription medications, is it like a clear-cut thing? They hand it to you and you're ready to roll?
No, I would not. Especially if it's a new medication.
Well,
Go ahead.
Who can you go to for more information about your new medication?
Well, I mean, again, one, you want to talk to your doctor about it.
Right.
Two, your pharmacist.
Yep.
I feel like I'm being quizzed here. I don't know if I'm
No,
express
that's
the
perfect.
answers.
That's
the
perfect.
answer.
Yes.
We helped you.
Well, you helped
Hey.
us too. Yeah, sorry. This is the segment where we cause Ron
one of the
undue
things-
stress and see what his
One of
reaction
the
is.
things, and again, I think we, had talked about it earlier, especially people that are on multiple medications from multiple physicians,
Mm-hmm.
that physician is prescribing a medication for a certain ailment,
Mm-hmm.
but they may not know what other physicians are prescribing. But if you're getting your prescriptions from the same pharmacy, they're going to have a list of all the prescriptions you're taking,
Right.
and they can probably give you a pretty good idea if one is going to counteract or have any adverse results
With
on another
one.
medication.
Right.
So in this case, your pharmacist is probably the best person to ask.
Right. And it's good to stay with one pharmacy.
If you can.
If
Yeah,
you can,
Yeah.
right.
That's great advice. And I think, like you were saying, the more medications you're taking, it becomes more complex. And for older adults or individuals taking multiple medications, sometimes it's best to ask, do I really need to take, because we're in our society, we want a pill and an instant fix. But sometimes, medications, there is a priority in which ones are like vital and which ones are kind of nice. So if you feel like you're overwhelmed with how many medications you're taking, ask, can we taper down? And that you should always taper down when you're stopping a medication, any of these, or, will diet, exercise, meditation, or anything else help alleviate some of the symptoms so that I no longer have to take this? And, if you've been on a medication for a long time and you don't have the result that they were hoping you would have, maybe you need to look for an alternative.
Good advice.
Okay.
All right. Well,
Actually, I do have one more bonus piece to add to that, too.
Awesome.
If you or a loved one has a certain illness as well, sometimes a prescription can enhance some of the effects of that, for example, disability that they have, just because whatever the disability is, I'm having trouble with my words.
Give me an example.
I have an example. I think
yeah.
A number of medications will lower the threshold for seizures. So if you're taking a medication and you have seizure potential, you may have more seizures while on certain medications.
Oh.
And people that don't normally have seizures may have seizures when they're on certain medications. I don't know, is that what you were talking about? Something like that?
It's more, yeah, that's along the lines of what I'm talking about. It's not, we were talking about the different medications, but for example, if you have like Parkinson's disease or, some other disease, some of the things that manifest from that disease could be affected by a different medication that you're taking.
Okay.
Right.
Or something new that's prescribed by a physician. So it's not necessarily just the medications itself, it's the disease or ailment that you or a loved one has, and all the side effects of that disease.
Right. Like we were just talking with.
In essence,
we were talking when we were talking with Anna.
She said like her system
doesn't absorb nutrients.
Right. So it also doesn't absorb the medication. But go ahead, Ron.
Well, no. I would just say it's something that it's like holistically. You want to have all the information for the pharmacist, or again, even the doctor, or the specialist, I should say too, because they would more specialize in what's going on with that specific disease or ailment.
Sure.
And they could tell you whether this drug or this prescription is going to have an adverse effect on it, even though it was prescribed for something else.
I see where,
Right.
So when your doctor is prescribing something, that might be the time to say, I know I included such and such in my medical history. Will this medication have an effect on, because I have that particular condition, or will it exacerbate my symptoms or whatnot? Yeah, that's a great bonus item.
Well,
what takes me 1,000 words to say, you can say in 100.
Not according to my editor.
Well, we're going to make sure that we include a bunch of links on our website, because this is a pretty important topic, and it'll allow our listeners to delve deeper into medication safety. And as always, if you happen to have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, Instagram, or TikTok.
And if you have a moment to spare, please give us a review wherever you get your podcast. And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.